A lot of nurses start looking into case management for one main reason: stress. And the assumption is pretty simple. If I leave the bedside, it has to be less stressful. But is that actually true? The answer is yes and no, because the stress doesn't disappear, it changes. And understanding that difference is really important before making the switch. At the bedside, stress is physical and immediate. You're constantly moving. You're going from room to room, managing multiple patients, answering call lights, giving medications, charting, and trying to keep everything on track. Things happen fast, and you're expected to respond just as fast. If something changes with a patient, you react right away. If something gets missed, it shows up immediately. It's a constant cycle of action and response. And over time, that can be exhausting, not just mentally, but physically. Now compare that to case management. The stress doesn't hit you the same way. You're not running from room to room. You're not dealing with alarms going off or call lights every few minutes. But that doesn't mean the pressure is gone. It just becomes more mental. Instead of reacting to what's happening right now, you're thinking about what could happen next. You're coordinating care, making decisions, and managing situations that don't always have clear answers. Let's walk through a real situation. A patient is ready for discharge. Everything looks good medically. The provider has cleared them. Now your job is to make sure the next step is set up properly. They need rehab placement. Sounds simple. But then things start to shift. There are no available beds at the preferred facility. Insurance is delaying approval. The family is pushing for a specific location that doesn't have availability. Now everything slows down, and you're in the middle of it. You're making calls, you're following up with facilities, you're checking insurance status, you're communicating with the family, and you're trying to keep the process moving. But here's the difference. There's no quick fix. You can't just act and solve it immediately. You have to work through the system, and that's where the stress comes in. It's quieter, but it sits with you, because you know the outcome matters. If this doesn't get resolved, the patient could be delayed in discharge, or end up in a situation that isn't ideal. That responsibility carries weight. Now let's look at another example. A patient is discharged. Everything was set up. On paper, the plan was solid. As the remote case manager, you call a few days later. They didn't attend their follow-up appointment. They didn't pick up their medications. Now you start asking, what happened? So you ask the patient, and you find out they didn't have transportation, or they didn't fully understand the instructions, or they thought they were feeling better and didn't think follow-up was necessary. You're trying to correct something that's already started to fall apart. And again, there's no instant solution. You have to rebuild the plan. You have to coordinate services. You have to prevent the situation from getting worse. That's the kind of stress case management brings. It's not chaos. It's responsibility. And that's an important distinction. Now here's where a lot of nurses start to feel the difference. At the bedside, you're physically and mentally drained. By the end of your shift, your body feels it. You've been on your feet, moving nonstop, handling everything in real time. In case management, you're not dealing with that physical demand. You're sitting more. You're focused on communication and coordination. But mentally, you've been engaged all day. You've been thinking, planning, adjusting, and problem solving, and that can still be tiring, just in a different way. So is it less stressful? For many nurses, yes, but not because it's easy, because it's more sustainable. It removes the physical wear and tear. It gives you space to think instead of constantly reacting. And for a lot of people, that's a better long-term fit. But it's also important to be honest. This role still requires responsibility. You're still making decisions that affect outcomes. You're still coordinating complex situations. And sometimes, you're working within systems that don't always cooperate. Insurance delays, limited resources, communication gaps, all of those can be frustrating. But the difference is you're not being pulled in 10 different directions at once physically. You have the ability to focus, to think through the situation, to work toward a solution step by step. And for many nurses, that changes everything. Another way to look at it is this. At the bedside, you're often reacting to problems after they happen. In case management, you're trying to prevent those problems from happening in the first place. And that shift alone can reduce a lot of the stress that builds up over time. Because instead of constantly putting out fires, you're trying to stop them before they start. Now, this role isn't for everyone. If you thrive in fast-paced, hands-on environments, you might miss that energy. If you enjoy being physically active throughout your shift, this might feel slower. But if you like thinking through problems, if you like seeing the bigger picture, if you like having more control over how you approach situations, then case management can feel like a much better fit. So when you ask, is case management less stressful? The better question might be, is it a better kind of stress for you? Because that's what really determines whether the switch makes sense, not whether the stress disappears, but whether it becomes something you can manage long term.